living in India, and in India all the laws of infertility are governed by ICMR. They have come out with rules, and it's a draft still in 2010. It has been presented to the Parliament, and we hope soon it shall become a bill. Thus, before we jump on to ARTs, it's extremely important that we know what is the law of the land. ICMR has categorized the clinics into three types: the level 1, level 2 and the level 3. The level 1 infertility clinics are where all the preliminary investigations are carried out to find out the type and the cause of the infertility. They may carry out all infertility treatment except handling the sperm, egg or embryo. That means they cannot do an IUI. They can carry out all investigations, which would include hysteroscopy, laparoscopy. They can carry out all ultrasounds, but they cannot do an IUI. Such a primary infertility unit can be a doctor's consulting room, such as a gynecologist or physician's consulting room, or even a general hospital. The person in charge of such a unit should either be a gynecologist or a physician. They should have an appropriate postgraduate degree, which means either a diploma or a degree, and they should be capable of handling all the above responsibilities. As I already said, all investigations like TVS, laparoscopy, even using of drugs for ovulation induction can be done by them, but they cannot do an IUI. Important thing is that such infertility clinics do not require a registration. Coming to the level 2 infertility clinics, these clinics require a registration with the ICMR. They can carry out investigations for the type and the cause, and they can carry out methods which require handling of the sperms. That means they have the facility and the right to carry out artificial insemination either with the husband or with a donor. Facilities for sperm preparation, IUI, including an appropriate clean room for IUI, is mandatory. They should have a provision for doing a room for semen collection with either a vibrator or an electroejaculator for men who are unable to produce semen easily. And they do not have any facility, or I would say they do not have the right to carry out any of the IVF or the ICSI procedures. Coming to the level 3, these are the tertiary infertility centers. These clinics require registration and will have to perform diagnostic and therapeutic at the highest levels of specialization with best of facilities. Even research, except on human embryos, can be carried out in these particular centers. If any of these facilities are not present in their own clinic, the clinic should have an access to such a facility in another appropriately accredited ART bank or a laboratory. What are the minimum requirements of a level 3 infertility clinic? They should have a gynecologist, an andrologist, a clinical embryologist, a counselor and a program director. The minimum requirements as far as space is concerned: a non-sterile area, a reception and waiting area for patients, an examination room with privacy, a storeroom, a record and an autoclave room, a general purpose clinical laboratory, steps for worming proofing, semen collection room, semen processing laboratories and a clean room for IUI. The forms that are required, that's a Form A, in which we tend to apply for a registration to the ICMR. Form B is the certificate of registration that the ICMR tends to give us. Form E is the one that is required for artificial insemination with husband, and Form F if you're using a donor semen. All of these particular forms are available at the ICMR website. We need to go to them, download these forms, and only these forms are the ones that needs to be utilized. Thus, I would only like to conclude by saying that ART centers, ART clinics are type 3 infertility clinics and they require a registration. Type 2 infertility clinics can do IUIs with AID as well as husband semen. They cannot do any ovum pickup or anything to do with the oocyte handling. And the type 1 infertility are where they can investigate, but they cannot even do an IUI. It's important for each one of us to know these particular laws so that when we go ahead with a particular registration, we are safe. Thank you.